Again, thank you for joining us here at Health Agents Network in collaboration with Bankers Fidelity. Again, we're talking about hospital indemnity and how to offer hospital indemnity plans. So go and get started. Now we're going to talk about an overview of hospital indemnity plans and also how to sell them. So one thing I want to stress is that it's on the scope of appointment form. You know, when scope of appointment forms first came out, we were all up in arms as agents. Oh my gosh, you're going to restrict what we sell. You're going to take away all these cross-selling opportunities for us. Well, they left dental, vision, hearing, and hospital indemnity on the scope. So make sure that you are offering it to your clients because CMS says you can. Take full advantage of that. When you're talking to your clients and talking about Part D plans and the Medicare supplements or the Part C plans, make sure they're initialing the hospital indemnity part because it's important enough for CMS to say you should mention it, so mention it. And it gives great coverage to your clients. So don't ignore the cross-selling opportunity with hospital indemnity because it's on the scope. So just do it. Trust me. My biggest regret on not offering hospital indemnity was not doing it soon enough because I found the more I asked, the more I sold. We'll talk more about that. Hospital indemnity, what are they? Quick overview. So hospital indemnity plans are designed to pay for some or all the costs of inpatient hospitalization. That's the thing is they're paid directly to the client or the policy holder. So it's not going to go to the hospital. It's not going to go to any other third party. It goes straight to the consumer. Now it works the MA plans obviously, but it'll work with other type of insurance as well. So if you have someone that's on group, they're going to stay on group. Guess what? You could offer them a hospital indemnity plan to offset that deductible they have when they go to the hospital. Maybe they have a $2,000 deductible, $3,000 deductible from their retirement plan. You know what? Most people don't want to pay that to the hospital when they go there. You could work a hospital indemnity plan in with group or a high deductible F. That's another opportunity to sell hospital indemnity with a Medicare supplement. So when you're talking to clients that want to save a bunch of money and they're comfortable with a deductible of $2,180, guess what? You can cut that deductible down greatly with a hospital indemnity plan. So the key to offering basically any plan is to make it simple. Confused minds don't buy. So just keep in mind that the more confusing you make this process, the less likely your client's going to say yes. Someone said, my clients set it up to be paid directly to the hospital physician. You can. It's a little more tedious that way. If you want to be paid directly to the hospital, the challenge there is what if you go to a different hospital? So I always tell my clients to have it paid to them directly just to streamline things. So of course they can assign it if they so choose. So great question. But back to the offering hospital indemnity, you want to offer one package solution. You don't want to go ahead and do one whole presentation. You want to walk through an entire presentation for a high deductible F or a Medicare Advantage plan, get the application signed and say, oh, by the way, I've got a whole nother presentation about hospital indemnity I'm going to show you. The buying process is over. The client signed, they're relieved, you don't have to make any more decisions. Now you're saying, hey, one more decision, here it comes. They're not going to enjoy that. So make it one package presentation, which we'll show you. Also, you have a responsibility to let your clients know it is available. One, it's on the scope, so don't hide it. It's right there. But two, you don't want to be that person or that agent that doesn't tell them it exists. Because if they're out for coffee with their friends or part of some group they belong to, because let's face it, a lot of these seniors are active nowadays. So they're in their knitting club, coffee club, whatever it is, and their friend says, yeah, I went to the hospital, but I got a check coming in because my agent said that I have this hospital benefit, or they gave me this hospital benefit. You don't want your client to be going, well, why didn't my agent tell me about this hospital benefit? How come I didn't get it? So you could be very passive. You don't have to be overwhelming with the product offering. I've always said to my clients, look, I'm going to talk about a couple different options for you. I just want to make sure you know everything's available to you. If you don't think it's going to work for you, that's fine, but I don't want to be the person that doesn't tell you about it, and then you're like, well, why did you tell me about this? So just go about it somewhat like that to kind of take the pressure off. Hey, I'm just going to tell you everything. You pick what's right for you. And that way it puts it back on the customer or the client to pick what's right for them, and they get full disclosure on what's available. So let's walk through an example. This is a generic summary of benefits I pulled locally. This is from my area. I live in Missouri. So example here, inpatient hospital care, $345 per day, days 1 through 5. So let's talk about that real quick. Here's how I would present it. Your hospital copayment when you're an inpatient is $345 a day, days 1 through 5. Days 6 and beyond, you're covered 100%. We do have the option of adding a hospital benefit to this plan that could cover most or even all the costs should you be hospitalized. We'll take a look at that later, okay? Now, a couple key points. One, I said hospital benefit. I didn't say hospital indemnity plan. You say indemnity to your average client, and they're going to look at you cross-eyed. Because, heck, I say that to half the agents I know, and they're like, well, I kind of know what indemnity means. That's okay. They're not buying indemnity products. They don't want insurance. They want the benefits that come with owning an insurance policy. So it's a hospital benefit because it is a hospital benefit. So never say hospital indemnity to your clients. It's always a hospital benefit. Second thing, cover most or even all the costs. You want to watch this because if the second year comes around and their hospital copayment goes up and the hospital name plan doesn't cover it all, and they get that extra bill, the remaining bill, they may call you and say, hey, Mike, you said this would cover everything. I still owe $100. What's up? So you want to say some or even all the costs. That way you give that gray area in case things change and they can't, and they're not changing the hospital indemnity portion, they could go ahead and understand that some or all the costs. And then we could take a look at that later, okay? It kind of takes the pressure off and then making a decision right there. I want one commitment from the client for a package. I don't want multiple commitments throughout the whole presentation on different products and get to the end and it's just a giant cluster. So we could do that later, okay? You know what 99% of people say to that? They say, okay. Yeah, we'll look at that later. Great. I don't have to make a decision now. Keep on talking, Mike. What else we got going on? So that is what I did in the field. And as I walked through the summary of benefits with a Medicare Advantage plan, as I got to other covered areas, or if I went over a covered area already, I would say, remember that hospital benefit I mentioned? It also includes funds for X, which could be ambulance rides. It could be post-doctor visits. It could be skilled nursing rider. It could be whatever the carrier is offering, and we'll take a look at Bankers real quick here in a moment. But you could backtrack, or you could say, oh, remember the hospital benefit? It also includes funds for this if you want. I always sold mine with the inpatient and the ambulance because I figure if they're going to go to the emergency room, they're probably going to take an ambulance, and they're going to have a $250 copayment for that. Let's make sure for a couple bucks a month that that gets covered. That's just something I did. Of course, you could structure the plans however you choose to. So at the end of the summary of benefits or at the end of your presentation, I would just go ahead. I planted all these seeds to say, hey, this is your plan. This is the hospital benefit. Let's take a look at the whole package. And I did the 3-option close. And here's what that looks like. Option 1. So for Medicare Advantage, you're sitting there talking to a Medicare Advantage client, and they say, you know, you have option 1, you have the plan with full copayment. So every copayment we looked at or every deductible we looked at, you will owe 100%, and that's X amount of dollars per month. Now, if you want to add the hospital benefit, you're going to get funds that will offset your hospitalization and your ambulance rides, either some or just about all of it, and that's X amount of dollars a month. Or you could add a cancer benefit for $5,000, that's X amount of dollars per month as well. So it gives a 3-option close. Now, statistically, most people will pick option 2. They don't want the cheapest, they want the best, right in the middle. If you go to any website that has 3-option packages for either subscription or buying a package, you'll notice that option 1 is kind of in the background, option 3 is in the background, and option 2 is big and bold. You know, most popular option is always the second option. People are trained to pick the middle. So guess what? That's where I position my hospital indemnity policy, right in the middle, where most people say, you know what, I'll take that. And you'll be surprised when people say, yeah, you know what, I want to do that. That sounds great. Let's do it. Because here's the thing. I've never had a client come to me and say, Mike, do you sell hospital indemnity plans? No, they don't say that. They don't know it exists. So let them know if the coverage is there for them. Now, as I mentioned earlier, even if you don't have a Medicare Advance sale or a Medicare Supplement High F sale, guess what? If they're going to stay on the group plan, you could offer HIP with any MA plan or with group coverage as well. It works regardless of what coverage they have because it pays the consumer directly. You go to the hospital, you say this many days, we give you a check for this much. We don't care what other insurance you have. We don't work with them. We work with the client. So offer it to your current clients, even if they're going to stay where they are, or even if they have group coverage you're going to stay with, or union coverage, or some sort of coverage that they're not going to deviate from, that's fine. You know what? The hospital benefit we reviewed, that works with this too. For only X amount of dollars a month, it is an option for you. And then you say, great, yes, I want to do that, or nope, no thank you, I'm not interested. And that's fine. But you went over their options with them, and now they understand what's available. Now, the other side of this is that's profitable. It maximizes your marketing efforts. If you think about it, all your Medicare supplement sales and Medicare Advantage sales, that's your core product. That pays for your gas, your office expenses, your taxes, which, can be very expensive. It pays for your cell phone bill, the lights in your home and your office and such. That's your base. This is where the profitability comes in. So you have no extra marketing dollars are spent to get in front of the client. So you're just adding extra commission on top of your marketing dollars, making your return on investment that much greater. And if you're selling Medicare Advantage, remember, you're not getting paid till January 1st or beyond, because you cannot be paid before the policy is in force. And when do all the AEP policies go in force? January 1st. Not with Hospital Indemnity. That's not part of AEP. It can be sold anytime during the year. You could go ahead and get paid right away. So you don't have to wait 2-3 months to get a check. You're going to get it whenever your next cycle is, which is great. Someone asked if Bankers are releasing HIP for under 65. It depends on the state. I would say call Bankers and go over that with them, because this is more, I work on a more national scale. I would say look at them and say, hey, what about ACA? Because a lot of ACA people, and that's a good point, can benefit from a hospital indemnity plan. So next steps, offer hospital indemnity. Just mention it. Just say, hey, do you have hospital benefit? I know an agent, I can't say this, so maybe you can, but I can't. He always looked at his clients and said, whatever you do, don't cancel your hospital benefit. And people are like, what hospital benefit? I don't have a hospital benefit. What do you mean don't cancel it? I don't even have one to cancel. What do I do? And he's like, oh, you don't have it? Well, let me tell you what that is. Now, again, I can't pull that off, but that doesn't mean you can't, or maybe you could structure it that way. Present one solution and, make it easy for them to pick. Because, look at your fast food establishments. We no longer order a cheeseburger, fries, and a Coke. We order a number 2 or a number 7 or a number 6. They have streamlined it to make it so easy for us to make a decision just to buy the package. Take note, because it works on the insurance field too. So no sale, offer hospital indemnity. Don't forget, hey, you know what? I would definitely still consider the hospital benefit, because when you go to the hospital, that's the most expensive thing you could do with health insurance. Let's offset those costs, so you're not worrying about how to pay a bill and get better at the same time. Now, I want to bring up the comparison grid, as you can see on your screen, from Bankers Fidelity. So you can see this is a senior security series, hospital indemnity policy. And you can get this from Bankers. They'll send it to you. And the one thing I like about Bankers is that they offer a 5-day, a 10-day, a 15-day with a maximum 2 events per year. But as you can see, there's some benefits. They'll send this to you. There's an e-application enrollment available, no application fee. There's optional things you could add, including the ambulance rider. So you can do it from $100 to $500 per day on an ambulance, max 2 days, but that's okay. The other thing I want to really point out on this is that there's only a 3-year look back on cancer, which is great, because most companies do a 5-year look back on cancer. And I'll highlight that real quick so you can see it a little easier. So cancer diagnosed or treated 5 years. Inpatient stays 3 times in 24 months. So it's only 3 times in the past 24 months. So if they went in once over the past 6 months, most carriers will say no, but Bankers will say yes. They do take insulin. Bankers is a very insulin-friendly company. I can tell you statistically 25% of your clients are diabetic. So Bankers has great options for diabetics. And then they're cheap. We like that. I shouldn't say cheap. They're affordable. They're right there competitively priced with better underwriting. So I think they're really positioning themselves well with the hospital indemnity market. Because let's face it, one of the challenges with this is underwriting. Because even though if you're out there selling Medicare Advantage, you don't have to worry about underwriting, this product you do. And this is some of the most lenient underwriting I've seen in the marketplace. So for COPD, there is a 1-year look back on COPD. Someone did bring that up. It really goes to complications. If you have COPD, they may kick it out. I always say if you got someone with COPD or chronic illness, ask if there's been any medication changes or any events from that disease. And sometimes you could call the underwriter and say, hey, I got this person, they have COPD, but it's under control. It's been under control for 5 years. No instances, no nothing. It's smooth sailing. And sometimes they'll make an exception. So those chronic illnesses, don't be afraid to go to bat for your client. One, your client's going to love it because you're going to bat for them. You're not just saying no. You're saying, let's see what we can do for you. The second thing is the underwriter may say, you know what, that's fine. We can go ahead and work with that. So don't be afraid to mess with chronic illnesses and talk to the underwriters directly, or call Bankers Fidelity direct and say, hey, here's what I have. What do you think? Or submit a letter with the application too. I've seen agents do that. I've seen cases that should be declined get approved because the agent went to bat for the client. So don't be afraid to push that. And again, the more you go to bat for your client, the more you're going to appreciate, the more you're going to tell their friends, the more referrals you're going to get. It's a win-win-win situation. But great questions. Thank you for asking. I definitely appreciate it. The biggest thing is offer hit. Is everyone going to qualify? No. Are you going to sell it at every single appointment? No. But if you don't offer, most people aren't going to ask, especially with hospital indemnity when most people don't know it exists. It's a perfect tie-in product with Medicare Advantage. It's a perfect tie-in product for group. It's a perfect tie-in product for high deductible F. A lot of agents steer away from it because the commission's not great. Well, this gives you an additional commission for it. It gives your clients, if they go to hospital, it cuts their deductible in basically half if they stay in for a couple days. So now their out-of-pocket exposure is cut down severely. It can really be an advantageous solution for your clients. So offer it. You know what? They're going to say no. That's okay. I guarantee, I shouldn't say I guarantee, but I can promise you, you start offering it, you're going to get clients that or start saying yes. Yes, I want that. And how great is it when they go to the hospital and they get a check in the mail and they're like, oh, sweet. I can go Sizzler 50 times now. Or do whatever they want with it. It's their money. They can do what they want with it. Of course, advise them to pay their hospital bill, but it's their money. Anything left over, too, could be used for additional doctor visits, any additional prescription drugs they're taking, any therapies they may need. So if they get the additional funds, make sure that they know what to do with it as well. Don't just say you can go to Sizzler 50 times now like I just did. That's not great advice. Taking care of themselves, taking better steps, getting those prescriptions that they have to take now because of the hospitalization, they may have the extra funds to do that. I've always, just a side note, I always padded my hospital indemnity plans. I always gave an extra $20, $30, $40 per day, and that way I told my clients, look, you need a little extra because you may have to take some antibiotics or some other drugs you may be on either part-time or permanently. Let's make sure you have coverage for that too, just in case that contingency, or follow-up doctor visits or specialist visits or post-op things. We want to make sure those instances are covered as well. And they're like, you know what, that sounds great. And that way next year too, if the deductibles or expenses go up, they have extra coverage for that too. So don't be afraid to pad it a little bit. Don't have to match it. Always pad it a little bit. It's only a couple cents or a couple dollars more a month, but the benefits still seen, the less stress over finances will be worth its weight in gold. So hopefully you got some great advice. Take what I said, you can model it to your own. You could mold it to make it work for you, but definitely offer hospital indemnity to your clients. If you're not, someone else will. And so if you go to your clients and just offer a basic plan and I come in after you and offer all these additional options they may have, who's going to be the hero? You that just sold the basic, or me that said, hey, you have all these solutions over here. Let's see which ones work for you. Is there a link you can download? Yes, there is an e-app. Definitely get a hold of Bankers Fidelity. They can get you all that information to do for you. I don't know if they have an electronic app on iPad or a tablet. I apologize, but we could definitely find out. And we'll put links. We'll post this on Health Agents Network. You'll get our weekly subscription now. We send out a newsletter every week. We have quick videos during AEP. They're maybe a minute long, and they're embedded in the newsletter. So just click it, watch it for a minute, and give you some extra advice. But this recording, along with any links to answer your questions, will be go ahead and on there as well. Someone said inpatient only, no outpatient. It depends on how you structure it. There could be you can add additional options for additional services. I mainly did inpatient and ambulance, but that was how I sold it, to make it more affordable and to make it easy to understand. But again, it's up to you and it's up to the client what's important to them. So we'll have some more links. That comparison guide will be available for download on Health Agents Network. It's healthagentsnetwork.com. It's open source. You can go there, look at it, sign up for the newsletter. We'll make sure you get on that newsletter subscription. It's free, and then you can go ahead and go. What observation? I believe it's in there. We'll take a quick look here.